Some people, it will be more mild symptoms than others, but in kids with comorbidities or other diseases, it usually impacts them more significantly. So I'd say kids with, for example, asthma, it might impact them. They're worsening asthma symptoms. So that's trouble breathing, wheezing, needing oxygen too. When they have those other underlying illnesses, it can make them sick. And that's just one example. There's lots of other diseases and illnesses that kids can have that um, can get worse when they have influenza. I wish that people didn't downplay it and take it more seriously because, you could be one of those people that has a child that does have the more severe symptoms and be impacted so much differently than you thought before.
We captured nearly 20 years worth of data on influenza hospitalizations in children in pediatric centers across this time period. And so therefore, having a large number of cases, there were about 13,000 hospitalizations during that time due to influenza in pediatric tertiary care centers in Canada, mortality due to influenza in children. It doesn't happen that often, thankfully, because we have access to the supportive care that children need when they do get a severe influenza infection. But it still does happen nonetheless. So I think that's one of the take-home messages of the study is that the flu is not just another benign cold-like illness. It can have serious complications that can lead to hospitalization, but also can even lead to death. And we know that young age is a risk factor for more severe influenza disease, in part because they haven't been exposed to as many infections with influenza, so they don't have as much immunity. And also in part, especially in young babies, they're more vulnerable because of the smaller size of their airways, less well able to fight off infections in general. We know that vaccines reduce the risk of medically attended influenza or hospitalization due to influenza and mortality in children by roughly 50%.